Now, one of the most interesting, fast-growing segments in this market is telehealth and presents a lot of opportunities. And one of the most innovative companies in the space is Doctor on Demand, and they are also an IHC affiliate. And joining us on the program today is Dr. Lena Cheng, Vice President of Medical Affairs for Doctor on Demand. Lena, good morning.
Good morning. How are you?
Great, Lena. Good to talk to you again. Nice to have you on the program. Appreciate you taking time out of your day.
Yeah, thanks for having me.
Hey, Lena, give our market a little backgrounder on Doctor on Demand, if you would, please.
Oh, sure. Well, Doctor on Demand is a company that focuses on video telemedicine. We consider ourselves to be a next generation video telemedicine company, and we feel what we're doing is really redefining the industry with a few different things. Best-in-class patient experience. We have a very unique business model in which we don't charge a per employee per month fee or integration fees. We have the ability to implement with any health plan, and we feel on the clinical side that we're establishing some best practices.
And you're consumers can access you via an app, right? I mean, employers can offer the consumer. It's an app that you download on your smartphone, correct?
Exactly. So you'll find our app in the App Store or Google Play. We also have a browser version as well. But we essentially work on any smartphone, any tablet, or any computer with a front-facing camera.
Yeah. Why should employers really care about next-generation healthcare?
Well, we're hearing a lot about issues with telemedicine, as it sort of today with a lot of legacy telemedicine companies. And with us, it's really a completely different approach to telemedicine, and it can end up being much more cost-effective, efficient, and really helpful for their employees. So, we've heard over and over again from employers in the market that they love the idea of telemedicine, but the promise of telemedicine really has yet to be fulfilled. They're seeing low utilization and, challenges with their employees getting access in a sort of an easy, seamless way. And, we feel that we've addressed that.
It's really interesting because the previous guest on this program was actually an employer, Vice President of Global HR for Sloan up in Illinois, and she was talking exactly about that they're measuring they rolled it out just for pediatrics right now, and they're really measuring the utilization to make sure this is really, catching on as a solution, and really talked a lot about education, and you'd probably agree with that too, that you can't just say, here it is, you've got to educate, right?
Yeah, education is a big piece of it, but really, what we ask employers to do is to expect more. I think a lot of employers are out there kind of, they've settled for 1% to 2% utilization, and we know that we can do better than that, and part of it is because when we first launched our service, we actually did so with consumers first. And that was very, very purposeful in the way we did that, because we wanted to test the product. We just wanted to put it out there to see how people were going to interact with it, whether it was something useful, and really analyze that patient behavior to see where were they getting, stuck, and is this something they were coming back to and using, multiple times. And so, because we did that, and our care is on demand, it's available on every device, video, it's really consumer-grade ease of use, then that's, in the background, we were putting together all our back-end support for our enterprise-level product. And so you put those two things together, and, we've got high utilization. It's just a different way of doing things.
What's the important factors in your solution or any solution to get that? It's one thing to get them to come and use it first. How do you get them to come back and use it? Is it about the patient experience?
Well, we think it is, and interestingly, I think maybe one of the biggest barriers is actually to get people to try it that first time, because it's a new behavior. Most people are very used to traditional ways of seeing healthcare providers. But when we look at our customers' behaviors, what we've learned is that once they do try it, we have a very, very high return rate. So I think it's close to 50% of the people who use it once, they will come back and use it a second, third, fourth time, for a variety of different medical issues. And then they'll also tell all their friends and their family and other colleagues and things like that. So within an employer setting, that's extremely important, to have people within the company who have tried it, and then it just word sort of spreads.
Yeah. Well, if I'm an employer, Lena, and I'm looking at telemedicine, telehealth solutions, what are the financial and market risks that I need to consider when evaluating the various solutions?
Yeah, that's a great question. On the financial side, it's really that I think where next generation telemedicine is going is that companies should be taking on that financial risk. I know it's very common in the HR space for vendors to charge a PEPM just to be able to, for a company to be able to offer something to an employee population. Well, if you think about telemedicine, and if some of these companies are getting utilization of 1% to 2%, that PEPM all of a sudden just doesn't make a lot of sense. And so what we're telling our employer clients is that, listen, give that risk to us. We will let you use the service. If your employees like it and love it, wonderful. If they, for some reason, they're not using it, then you're not on the financial hook for that. So if you think about the way, revenue works, you look at a legacy or a first-generation telemedicine company, and 75 to 85% of the revenue of, the top three first-generation telemedicine companies comes from PEPM fees, with only 15 to 20% of their revenue, 15 to 25% coming from patient care. And then with our model at Doctor on Demand, almost 100% of our revenue comes from, delivering healthcare to people. That's patient visits. So it's really, from a financial perspective, a very low risk or even no risk way for an employer to see whether telemedicine is a good fit for their employee. And then on the market side, this really goes back to what I mentioned a little earlier, and that is that, you want to make sure that what you're offering to your employees is going to be of value, it's going to be used. And so that's why, we, with our launch to consumers first, we took a lot of that market risk out. We made sure that, because we fully tested it in the consumer market, and that there was demand without us doing much, to promote it and all that once we rolled it out to the enterprise, we knew it was something that people were going to use and be delighted by.
Mm-hmm. What are the regulations plays a pretty key role here as it relates to telehealth? What are some of the challenges? What are some of the potential hurdles or even good things that are ahead as far as the regulatory environment?
Yeah, what we're seeing right now is that increasingly video is becoming the standard of care in telemedicine and really required to establish that initial physician-patient relationship. So you have organizations like the Federation of State Medical Boards, the American Medical Association. In 2014, they put out their official guidelines on what constitutes legitimate telemedicine. And what they identified is video and something called store and forward telemedicine, which is capturing an image or a video or something and then forwarding it to somebody for their analysis at a later time. And what's not under there is telephone, text, email, things like that. And this is, as much as they could, they gathered evidence to kind of back up these statements. So there's evidence to support that video and store and forward are very clinically appropriate ways to make clinical assessments, whereas with these other forms, telephone and others, physicians really don't, they cannot have enough information to make proper diagnoses and then to put together treatment plans and then, of course, to prescribe medication. So what we're seeing is that with organizations like those putting together these official guidelines, they have tremendous influence over what the individual state medical boards kind of put together for their own states. And so we're fully expecting that in 2015 and certainly beyond, that things like telephone telemedicine will be not allowed. It'll be illegal, and that really it's video is going to be the standard.
That's interesting. That's very interesting. What the emerging private exchange market? You would appear to be a natural solution to fit with some of these private exchange platforms. Are you out there working with them, your team?
We have dabbled in it. I have to say we are focused a lot on the employer market, kind of going directly to employers or working through benefit consultants and brokers. How we feel about private exchanges is that we think we're a great fit because it really lends itself. So our product lends itself so well to the idea of healthcare consumerism and people taking that much more ownership in their healthcare. So I would say, while we don't do much of it today, we do have a very big interest in, taking a bigger role.
Yeah, it would seem to be a natural fit for you. Is there a concern or that if I'm an employer, what's the concern about a telemedicine company's ability to integrate with insurance carriers, or what are the challenges there?
Sure. Well, that's a great question because I focused a lot about sort of the patient experience and what's great for the employee. And but what's also key with a next generation telemedicine company is, HR departments are asking, well, how seamless are you going to make this for me? And all of that means, what's the contracting process like? What's the integration plan? What are all those back end things that you're going to do to make sure that this runs seamlessly from an administrative standpoint? And that's something that we take very seriously. We integrate with any health insurance carrier in the market, and we do that through an API that allows us to do real-time checks of employees' eligibility. We can submit claims real-time. We can track employees' spends against deductibles and kind of real-time also calculate their out-of-pocket expenses. And so today, we're working with Aetna, Cigna, Anthem, Blue Cross, Blue Shield. But, what's also exciting is that we actually, we have a new relationship with a large health insurance company that we're going to be announcing fairly soon, and very excited about how easy then it will be for employers with that insurance carrier to integrate with us.
Okay. Lena, it's been great having you on the program. I'd like to give you an opportunity to leave our audience with 2 or 3 takeaways.
Oh, great. Yeah, thanks for that. Well, I think what I would say is that first I would really push employers and benefit consultants and brokers to expect more from telemedicine solutions today. Kind of put aside what they think they know about telemedicine. Take a look at next generation telemedicine, everything from the patient experience to the fee structure, the clinical quality, and taking a really good look at, things like utilization levels. Is this a company that will offer a service that will truly be useful to employee populations? And then the second is that, I think having sort of a mind shift in putting the onus of engagement and utilization on the telemedicine company, taking a lot of that financial risk away from employers and putting that on the company to say, is this going to be a value? We want you to show us that it will work. And then the last thing is, from a regulatory standpoint, sort of recognizing that, video and store and forward telemedicine, those are really regarded as the two forms of telemedicine that are becoming essential components for regulatory compliance. And any telemedicine company that people work with should really be focusing on those, because they think the old forms, first-generation forms of telemedicine will probably not be around for much longer. So you really want a company that excels at those forms, especially, of course, we're biased. We focus on video. But I think it's extremely important to keep in mind.
Lena, that's great, and I really, really appreciate it. And as I said at the beginning of this program to the audience out there, you can come hear Lena speak at our June forum in Atlanta, June 23rd. Doctor on Demand will be there as well as part of our Innovation Showcase, and they're an IHC affiliate. You can find information on Doctor on Demand, certainly at their website, but also in our website. Lena, again, thank you so much for taking some time out of your day. This was very informative, and you have a great weekend.
Thank you. Thanks for having me.